Thank you very much. So hello, everyone. We will get started right now. Good morning and good afternoon, everyone. It is a pleasure to welcome you to this side event hosted by UNFPA and the government of Argentina, alongside with the high-level political forum on sustainable development entitled Intergenerational Action for Bodily Autonomy, Accelerating SDG number 3. Before we kickstart our event today, I would like to remind everyone that today's event will be live streamed in English with International Sign Language. We will upload the French and Spanish versions of the event on the event website at UNFPA.UNFPA/HLPF 2021 in the upcoming days. If you would like to share the reflections or questions, please use the chat. Engage with our conversation online using the hashtag #MyBodyIsMyOwn and tag speakers and organizations if you can. Lastly, during the course of this program, I won't be reading the full bios of our speakers. You can find the bios on the event website or by clicking in the link we are sharing on the chat. My name is Eunice Garcia, and I am the Executive Director of the Youth Coalition for Sexual and Reproductive Rights. Our objectives today's event are to explore the contribution of bodily autonomy to the full achievement of SDG number 3, and universal health coverage. By bodily autonomy, we are referring to the ability of women and girls and gender non-diverse people to make their own choices about their bodies and their futures, to have their information, services, and means to make their own choices on sexual and reproductive health and rights, free from discrimination, coercion, and violence. For me, representing the Youth Coalition in this topic is critical because young people are leading the conversation and the discussion on bodily autonomy. Just last week at the Generation Equality Forum, young people led the way in bringing the world's attention to the fact that without empowering young people to make their own choices about their bodies, there cannot be gender equality. The YEC is working very hard to make sure that young voices in all their diversity are meaningfully represented and participating in SRHR decision-making. The Youth Coalition also believes that there cannot be youth-centered policies without meaningful youth engagement. And we need to bring in these diverse and intergenerational voices as we march in our efforts towards elevating rights and choices for all. This is why we have also committed as the Youth Coalition to work for the next 5 years on bodily autonomy, to bring more diverse young people to the table, to the decision-making spaces, and to create enabling and nurturing environments so that everyone can participate and everyone can decide on their own what are their priorities on bodily autonomy and how to move forward in this international agenda. So first, now to officially begin the program, it is my pleasure to hand the floor to the two co-conveners of this event. First, we will hear from Dr. Julita Onabanjo, who is the Regional Director from East and Southern Africa from UNFPA. Please, Dr. Julita.
Thank you.
The floor is yours.
I'm here. Thank you, Eunice. Honorable Ministers, Excellencies, ASG Peterson, distinguished delegates, young advocates, colleagues and friends, it's an absolute pleasure to join you virtually from Johannesburg. Dr. Natalia Kanem, who would have loved to be with you this morning, had asked me to extend a warm welcome to you all and to thank the government of Argentina for co-convening this critical dialogue with us. At this side event to the high-level political forum, I think we have a distinct opportunity to elevate the centrality of bodily autonomy and sexual and reproductive health and rights as catalysts and cornerstones of efforts to achieve good health and well-being, gender equality and sustainable development in indeed this decade of accelerated action. The forceful momentum created at the ICPD summit in Nairobi in 2019 and the commitments generated by diverse stakeholders to ensure we finish what we call the unfinished agenda of the ICPD program of action, and especially our collective commitment to advance universal access to sexual and reproductive health and rights and gender transformative actions in general, must be built on. As Dr. Kanem would have said, the march must continue. We must march on. Indeed, UNFPA has been working tirelessly with our partners to strengthen attention and action to bodily autonomy, including our role as co-conveners with our partners of the Generation Equality Action Coalition on bodily autonomy and sexual and reproductive health and rights. And indeed, last week in Paris at the Generation Equality Forum that Eunice just mentioned, we witnessed not only young feminists, but I think young advocates and leaders and representatives from all over the world who called for that greater attention, the greater funding, and actions to promote and protect bodily autonomy, essential to achieving the SDGs, particularly SDG3 on good health and well-being, and SDG5 on gender equality and women's empowerment. The UNFPA flagship State of the World Population Report 2020, My Body is My Own, states that communities and countries can only flourish when all women are protected and have the power to make their own informed decisions about their bodies and lives, that power to say yes and the right to say no. So distinguished delegates, sustainable development can only happen, we think, if populations are healthy, and that path to good health and well-being for all is inextricably linked to bodily autonomy. And as Eunice defined, that being the ability of women and girls to make their own choices about their bodies, their lives, and their future. A study UNFPA referenced in our flagship report that I mentioned revealed, I think, what we think is disturbing statistics, that only 55%, that's just 1 in 2 women, can make their own decisions about their bodies, including whether to have sex, to use contraception, or access health care services. And in addition to that, every single day, 33,000 girls are locked into marriages against their will. And in a single year, 4.1 million girls are at risk of FGM, female genital mutilation. These are clear violations of girls' and women's bodily autonomy, integrity, and human rights. And I think we can all imagine what it would be like when many children are married off or can't stay in school, when women are subjected to a life of intimate partner violence. And such a girl and woman stands little chance of self-determination or empowerment in the home, community, and workforce, or anywhere else. And we know this is just not our imagination. This is the reality for many. So in denying her of her fundamental human rights, she's entrapped in a circle of injustice and a downward spiral of what we think is self-deprecation and doubt. This in turn impacts her immediate family, household, societies, economies, and really reverberates across the world and across the Sustainable Development Goals. In short, this affects us all. And this is why as UNFPA, we work for a world where every woman, every girl, and every young person can realize their full potential. They can have agency, autonomy, and confidence to chart their future. They can have information, education, and services, and the means to make their own choices on sexual and reproductive health and rights, and can do this free of discrimination, coercion, and violence. And so today's important dialogue comes at a critical point, I know, in the time of the world when we continue to grapple with COVID. We have seen heightened forms of all types of multidimensional and intersecting inequalities. There has been disturbing upsurges in gender-based violence, in child marriage, and in unintended teen pregnancies, as access to integrated, comprehensive, and sexual and reproductive health services have been disrupted. As UN Secretary General Antonio Guterres said in his remarks in Paris, the realization of equal rights of half of our population is the unfinished human rights struggle of this century. And we would like to add that this is also the unfinished development struggle, as the world cannot move forward. Indeed, the world cannot develop when half of humanity cannot make their decisions and are held back. So distinguished friends, we know what must be done, and I know time is not of the essence, but we know we must pursue this intergenerational dialogue, this collaboration, this solidarity that we have amongst ourselves across diverse actors of all ages as an essential means to achieve SDGs. Advancing bodily autonomy is not only possible through a whole system approach, but that includes the voices and perspectives of the different stakeholders and the role players rallying together even more towards that common goal of rights and choices for all. And I know I've been in the field for many years and I've seen this in fantastic examples, and I know that the panelists will share those with us this morning. Secondly, I think we must all be advocating for universal health coverage as part of our efforts to build better as we move forward together for sustainable and resilient recovery. And again, I reiterate, there can be no health and well-being if there's no bodily autonomy. And this can't happen if we do not achieve stronger and more resilient health systems, including universal health coverage that upholds sexual and reproductive health and rights, and that incorporates empowering girls and boys to make healthy decisions about their bodies, their health, and their lifestyles, because the life course then becomes important. Third is the priority we must put on collective action to dismantle those discriminatory attitudes, practices, and harmful social norms, including gender stereotypes and stigma and racism. And that spills over to the policies and laws that really restrict access, particularly to comprehensive sexuality education and SRHR for many. And fourth is our collective action to leave no one behind. Supporting every person's ability, especially those furthest behind, in exercising their own decisions about their bodies must be central to our collective mission. And the voices of women and girls, men and boys, across generations, across geographies, across diversities, across abilities, will allow for lived experience, perspectives, and priorities of all to shape sustainable and inclusive development policies and programs and deliver on our common commitments and promises. Let me end by restating what I think is the bottom line. The rights of bodily autonomy is inalienably a human right. And when we uphold the rights, particularly for women and girls to exercise decisions related to their bodies, we uplift families, communities, and entire nations. And in so doing, we accelerate a sustainable present and future for us all. Once again, welcome to all of you all. And without further ado, I hand you back over to Eunice as we listen and learn from generations of experts and champions we have with us today, indeed a cross-generation of and for equality and sustainable, healthy world for us all. I thank you. Back over to you, Eunice.
Thank you so much, Dr. Yulita. And I think that the statistics that you just shared with us are very alarming. And as young people, we also want to recall that we need the recognition of the agency of girls and adolescents and gender non-conforming people, and they must be in the agenda, because without the recognition of their identity, then there are no services available for them. Now, we were going to have the Minister of Argentina. We were going to have Honorable Minister Carla Bisotti, but unfortunately she has been called to a high-level meeting and she's unable to join. However, we have with us Ms. Valeria Isla, who is the Director of Sexual and Reproductive Health from the Ministry of Health from Argentina. Welcome, Minister. Please come on in and share with us your remarks on bodily autonomy and the experience of the Minister of Argentina in this field.
Muchas gracias. Es un honor para la Argentina copatricionar este evento sobre la acción intergeneracional para la autonomía corporal con el objetivo de acelerar el objetivo de desarrollo número 3 en el marco del Foro Político de Alto Nivel sobre Desarrollo Sostenible. Quiero traer los saludos de la Ministra de Salud de la República Argentina, Carla Bisotti, y el apoyo del gobierno argentino a este foro y a esta iniciativa. La Argentina, como ustedes saben, ha dado un paso enorme para garantizar la autonomía corporal de las niñas, de las adolescentes y de las personas con capacidad de gestar, habiendo sancionado y entrando en vigencia la ley 27610 de interrupción voluntaria y legal del embarazo. Esta ley ha sido el producto de luchas de colectivos, de jóvenes, de adolescentes en la Argentina, llamadas las pibas, que han estado en las calles acompañadas también por las generaciones de las feministas históricas que han luchado por la autonomía corporal de sus cuerpos. También hay un movimiento muy grande en relación a la educación sexual integral. Y esta ley que nos trajo el 2020, producto, como decíamos, de esta lucha, se ha incorporado en la política pública de Argentina. La legalización del aborto en la Argentina estaba vigente desde 1920 a través del Código Penal, con la ILE llamábamos aquí, con la interrupción legal por causales, lo que incorpora la ley 26710, es la posibilidad de acceder hasta la semana 14 inclusive a la interrupción voluntaria del embarazo sin dar ningún motivo. Las niñas, adolescentes y personas con capacidad de gestar a partir de los 13 años pueden requerir, pueden acercarse a un servicio de salud en forma autónoma y poder tomar esta decisión. Y las niñas menores de 13 años, víctimas de abuso y de violencias y de otros problemas ligados a la vulneración de derechos sexuales y reproductivos, pueden elegir según su interés superior, su autonomía, a la referente adulta que las pueda acompañar en este proceso. La Argentina ha dado un avance enorme en este tema. Esta ley es de orden público, se implementa en forma simultánea en las 24 jurisdicciones de la Argentina y el gobierno argentino acompaña la construcción de la política pública con la compra y distribución de misoprostol para poder realizar esta práctica, y la consejería, que es un espacio específico, digamos, de autonomía, donde se juega en el momento donde con enfoque de derechos trabajamos, la consejería en salud sexual y reproductiva es un momento de profunda autonomía en términos de brindar información con transparencia activa para que las adolescentes, jóvenes y personas con capacidad de gestar puedan acceder a las mejores condiciones de calidad, privacidad y autonomía a este derecho. La Argentina también ha desarrollado, la ministra Carla Bisotti ha firmado en el mes de mayo el protocolo de atención a personas con derecho a la interrupción del embarazo, que permite regular, permite dar herramientas complementarias a la ley, profundizar y dar elementos a los equipos de salud para poder garantizar este derecho. En este sentido, el Fondo de Población de Argentina, integrante del Consejo Asesor de la Dirección Nacional de Salud Sexual y Reproductiva, forma parte del apoyo y de los colectivos de la sociedad civil, junto con socorristas, con las redes profesionales, con redas, con la cantidad de profesionales de la salud que en este contexto de pandemia garantizan los derechos sexuales y reproductivos y trabajan también en la prevención de lo que es el abuso sexual hacia niñas, niños y adolescentes y los embarazos forzados. Ese compromiso de la sociedad civil, de los equipos de salud y de las autoridades, y en este caso de la ministra y del Poder Ejecutivo en su conjunto, junto con la ministra de las Mujeres, Género y Diversidad, Elizabeth Gómez Alcorta, Vilma Ibarra, secretaria legal y técnica, acompañan la voluntad política también del presidente de trabajar estos temas, de garantizar y contribuir al objetivo de desarrollo 3, no solo con la legislación, sino con la construcción de políticas públicas que permita garantizar a las niñas, niñes y adolescentes de nuestro país el ejercicio pleno de la autonomía sobre sus cuerpos y el ejercicio en libertad de sus derechos sexuales y reproductivos. Muchas gracias.
Thank you so much, Valeria, for your remarks. And yes, as a Latina, I think that the example of Argentina and the way in which Argentina has been legalizing abortion, and also the way in which Argentina has been recognizing that there are diverse bodies with the capacity of giving birth are essential for achieving bodily autonomy, and Argentina is a great example for all of us. So thank you so much for that. And now I would like to introduce Ms. Alejandra Chichikova, who is the first ever Miss Wheelchair World to deliver her keynote speech. Alexandra, you're a strong role model and a fierce advocate for the sexual and reproductive health and rights of women with disabilities. From your perspective, why is bodily autonomy so important, and how does it link to gender equality and sustainable development? Over to you.
Hello.
Hi.
My name is Alexandra Chichikova. Greetings from Belarus. It's a great honor and privilege for me to be invited as a keynote speaker at this important dialogue, taking place along the margins of the 2021 high-level political forum. This is a topic that is near and dear to me. As a key influencers, religious leaders, representative of non-profit organizations and public associations, together we are searching how to support bodily autonomy of women and girls and other vulnerable groups everywhere, especially in the broader context of health and rights for all. I would like to express my appreciations to UNFPA and its Executive Director, Dr. Natalia Kanem, for her leadership and selfless commitment to our organization's cause. I also would like to thank you all for the opportunity to speak to you today. Every woman has her wishes, her feelings, her talents, her dreams. She can become a diplomat, a doctor, an advocate, a farmer, or she can become a mother, but only when she wants it. Women all over the world have the rights to family planning, rights to decide whether and when to give birth. And they definitely have the right to say no to unwilling touches, no to forced marriages, no to human trafficking, and no to harmful practices. Women have rights, and our mission is to be vigilant about the respect for human rights to ensure that rights of women and girls are upheld by all. Despite all measures taken nowadays, we can see how the COVID-19 pandemic badly affected the situation with regards to gender equality, the access to family planning services, and the SRHR of women and girls in general. Women and girls face the fact that in hard times, their rights are not treated as really significant. Today's event is dedicated to bodily autonomy. Bodily autonomy is not only the ability for women and girls to make the choice regarding their body, it's the ability to make the choice regarding the future as well, and for the future of their families, communities, and societies at large. The ability of women to control their own sexual and reproductive choice, the ability to live without pressure and free from violence will enable gender equality and a peaceful, inclusive society. Bodily autonomy means much more than basic rights. It's a gateway to the future for each personality. When our bodily autonomy is secured, we can be our true selves, try something new, release our potential. Bodily autonomy is a shield that prevents hurting us and breaking our dreams. Only behind the shield, we can truly listen to our own hearts and follow our own dreams. Securing bodily autonomy requires integrated and cross-cutting approaches. Efforts from non-governmental organizations will not be enough. We need state leaders, politicians, ministries of health, gender, planning, finance, international and regional organizations to join forces and to collaborate effectively with local influencers, religious and traditional community leaders. We must reach consensus on such an important topic as bodily autonomy, consensus between different cultural groups, between different religious and civil societies, and between generations as well. It's impossible to switch from an imperfect world to a perfect world one overnight. Changing our world by the better, day by day, step by step, is possible only if all generations understand and share the values and accept the need to change. This is why today's discussion is so important. This is why I'm here. This is why we are all here. I'm excited to learn from all the experts that are here today. In the High-Level Commission on ICPD 25 follow-up, we work on the 2021 report in which we are planning to be very clear about the meaning of rights in the context of sexual and reproductive health and bodily autonomy. We are going to illustrate that SRHR, bodily autonomy, and people's agency is more than a health issue, as it interconnected to social and economic justice. It's a sustainable development issue. As a member of the High-Level Commission, I will work to make sure that the messages and actions that I highlighted today become a part of our agenda as we continue to fight for gender equality, SRHR, bodily autonomy, and a more sustainable world for us all. Thank you.
Thank you so much for those remarks, Alejandra. I really think that the disability justice movement has taught us many very valuable lessons that can be applied to all the movement on sexual and reproductive health and rights. And I also believe that the disability justice movement is key to advance sustainability and to advance the SDGs in all their extent. So thank you very much for that. And now we will move to the panel discussion. As we move into this discussion, we also want to hear from you. As I mentioned earlier, please share with us your thoughts, questions, and reflections using the chat box. Now, let me begin by introducing the panelists today. I am joined by Honorable Emma Inamutila Theophilus, who is the member of the Parliament and Deputy Minister, Information and Communication Technology from the Republic of Namibia. We also have Madame Mavis Nakorli Ari, who is the member and national radio host from Curious Minds. And we also have Dr. Pira Waiswa, Associate Professor of Health Policy Planning and Management, School of Public Health, College of Health Sciences at Macquarie University. We also have Dr. Yoya Adele Perry, who's the founder and president of the National Birth Equity Collaborative. And we also have Madame Maria Teresa Rivera, who is a human rights defender and a women's rights activist. So thank you so much all for joining us. And now I'm gonna go to the questions that we have for you. And well, this is very exciting for me, and let's begin with this panel. Okay, so I have a question for Emma Inamutila Theophilus. Honorable Minister, in your career, you have championed the rights of women and girls as a youth leader, and now as a member of the Parliament and Deputy Minister. And I can just imagine how much experience you have in meaningful youth engagement. What are some of the ways that your work has been able to advance sexual and reproductive health and rights and promote bodily autonomy of girls and women in your country and beyond? And what are some of the systemic changes that you would like to see in the health system around decision-making that upholds sexual and reproductive health and rights? Over to you.
Thank you. Thank you so much, Eunice. Honorable Ministers, Excellencies, my UNFPA family, led by Dr. Jolita here today, fellow young activists, ladies and gentlemen, greetings from the Republic of Namibia, Windhoek. It is an honor for me to join you this afternoon here for this UNFPA, the Government of Argentina side event, high-level political forum, and intergenerational action for bodily autonomy and accelerating SDG3. Thank you so much, Eunice, for that lengthy question. I hope I'll be able to answer it in the time allocated because I have so much to share with all of you. I think first I'd like to reflect on my personal journey. First, I started as a volunteer at after-school programs where I quickly learned through comprehensive sexuality education. I learned more outside of school than I did in the classroom. And that's the unique ability of after-school programs to complement school programs, because there are many challenges that come with either lecturers or teachers who might not be very comfortable with giving the curriculum in the classroom, and supplemented by after-school programs or out-of-school programs that come in very handy to teach young women, girls, and young people in general about their bodily autonomy. And I learned quite a lot. And through my volunteering at that after-school program, I was able to share that knowledge with my peers and the young girls that look at me for guidance and advice, including my younger sister. And that quickly moved on to me becoming a student leader in the National Students Organization and at the university, and quickly learning, seeing my fellow learners falling pregnant and what role I had to play as a student leader, and a female student leader at that, in trying to fundraise for their uniform, because as their bellies grew, they could not fit in their uniform anymore, trying to fundraise for the supplies for their unborn babies when they become born, and having that enabling environment and safe space for them to freely come back to school. Because the truth of the matter is, for example, in Namibia, we have a policy that allows young mothers to come back to school, but the discrimination and the stigma sometimes keeps these young mothers away. So I learned very quickly in my student leadership to try to create that safe space with the support of life skills teachers and teachers who have gone through that experience as well, to make sure these mothers come back and finish their schooling, because it would not be fair for them to not just come back because of the stigma and discrimination. And that allowed me to get the voice to want to advocate for mothers like this and for young women like this. And I joined what we call AFRI Namibia, which is the African Youth and Adolescents Network. And later I became the finance officer, and that advocacy work really squared around SDG3, advocating for bodily autonomy and the freedom to access and exercise sexual reproductive health and rights, and more importantly, for the equality of the access for the sexes, sorry. And that experience, I think, led me to being appointed as a deputy minister and a member of parliament at the age of 23 last year by His Excellency the President. And as someone who has lobbied for so long for young people to be part of spaces of decision making and to be in rooms of decision making, it was a dream come true, not only for me, but for also young activists in Africa, in Namibia, in my country. And it's something that I'm thankful to His Excellency the President, Dr. Hage Geingob, who has always demonstrated his ability to bring the equality of the sexes and women into positions of decision making. And that is why, Eunice, I did not waste any time. After being appointed last year, although I'm a deputy minister of ICT, I recognize that I am a member of parliament, and I should bring advocacy and mileage to the issues I hold dear to my heart. And that is why earlier this year, I moved a motion in parliament to remove tax on all sanitary pads in Namibia. And I can proudly say that has become a reality. There is no tax on sanitary pads in Namibia, and that brings Namibia part of the countries that are moving towards making sanitary products free for young women and girls. So for me, that is an achievement, and that is something that we can all emulate as states across the world. And of course, the truth of the matter is, transitioning from adolescence to my youthful years and being a young woman in leadership, it becomes my sole responsibility to ensure that as a country, Namibia specifically, through our gender strategy, trying to ensure that we reduce gender-based violence in the country, I'm able to use the mileage I have, my political mileage, as a young activist, as a young lawmaker, as a young deputy minister, to ensure that the issues related to good health and ensuring that sexual reproductive health rights are accessible and are able to be exercised by young women becomes a reality. And I commit to doing that wholeheartedly. Thank you very much.
Thank you so much for those words. I would love to have so much more time with you to talk about all of these amazing changes, because I think that as young activists, it is a priority for us to push for better out-of-school CSC programming, understanding that young people do not look for information within schools, but they look for information on the internet with friends, with peers, and that is so important. And also, I think that the matter that you just brought into the conversation about menstrual health and how we perceive and how we talk about menstrual health and how we make decisions around menstrual health is crucial for bodily autonomy. For young people. This is crucial, and this is something that during the Generation Equality Forum and some consultations that the Youth Coalition hosted, this was a priority for adolescents as well. So thank you so much for those words. And now I'm gonna move to Mavis. So now I'm gonna go with, so for Mavis Nakorliari, who is the member and national radio host and also member from Curious Minds, I want to ask, Mavis, as a young woman advocating for gender equality, what would you say are the key issues when it comes to empowering youth to make their own decisions and choices about their sexual and reproductive health and rights? How does promoting bodily autonomy contribute to gender equality, and how can this drive to sustainable development? Over to you, Mavis.
Okay, thank you very much, Eunice. And so for my volunteerism and being a youth advocate with Curious Minds Ghana, engage a lot of young people and also to involve them or to engage with other young people in the community at the community level. Some of the issues that readily comes to mind when we talk about bodily autonomy and even empowering young people, we talk about the access to the right information. So we all know that the first step to empowering an adolescent or to empower a youth becomes the information and education provided to that young person, and that informs the right decisions that these young people make. And so talking about access to the right information, we know that in these modern times when a lot of adolescents have access to technology and have a lot of information on the internet and have a lot of information coming from their peers, there is the need to ensure that they are getting access to the right one. But on the internet, we are not sure the kind of information that they get. There's the wrong one, there's the right one. And so it means that someone needs to guide these young people in making sure that they have access to the very right information that they need, that is concerning their sexual and reproductive health. And for instance, when it comes to menstruation, some adolescent girls face a lot of issues when it comes to their menstrual health. And so this becomes a very confusing and a very dicey stage for them, that they need an information, they need someone to tell them what to do and what is actually happening to their bodies. But for instance, in certain communities, even in the home, a lot of adolescents are not getting access to this information from their parents, who happen to be their first point of call when it comes to their decision making. And so we ask that, who do they get the information from? Maybe we are expecting that adolescents get the information from schools, because those of them who find themselves in schools can get their teachers talking to them. But in a lot of the schools, teachers are not going deeper into some of this sexual and reproductive health education, because that is not the focus. So there's the reproductive health education that is being provided, but it isn't thought very crucially or very comprehensive for the adolescents to understand what to do, how to go about a certain situation and all of that. And so access to information, the right information, becomes a very critical thing to talk about. And then also we talk about the practicing of the information that the adolescents get. It is one thing getting the information, it's another thing practicing whatever you know. And so the issue has to do with the confidence that adolescents have to even practice the information that they are being given by the right people. And so you find adolescents having to negotiate sex at the time when maybe they are sexually active, but because they haven't built that confidence, she knows that when I say yes to this guy and have any intercourse, I'm going to get pregnant. But because of the lack of confidence and assertiveness, she's unable to say no to unprotected sex. And so whatever has to happen, happens. And then there's there's unwanted pregnancy or unintended pregnancy, which the adolescent is actually not ready for. And there's the need also to even think about STIs, which is HIV, and all the other things that comes to mind. And so practicing, encouraging adolescents to practice the right information they are given is also one thing that really plays out when it comes to empowering adolescents or empowering youth to make the right decisions, and also to empower them to make the decisions that promote bodily autonomy. And then also we can talk about the access to services. We always say that adolescents don't only need the information, but they also need services. But when it comes to the monies they have to pay for these services, or even the places they have to access these services, it becomes a challenge, because some of them are living in geographical locations where facilities are not too close to them, and it becomes very challenging for them to move from their homes or from their communities to other communities to access services. And so by the time they would even think of going to a facility, they would have made any risky choice or whatever they have to do about it. And so that is also another thing. And then talking about even visiting the facility, there's a lot of stigma, because in our communities or in the places where we find ourselves, adolescents are supposed to be in school and not supposed to be sexually active and all of that, even though it is no fault of theirs that they are sexually active. And so the stigma that is attached to seeing adolescents in some of these facilities to access maybe contraceptive services, they do not get it. And so because there's no time, I'm sure that I would have to end here so that moving on, we can talk about it. But there's the need to also realize that adolescents must access the right services so that the information and the promotion of bodily autonomy for adolescents is realized. Thank you very much.
Thank you so much, Mavis. I think that you touch upon like very, very crucial things. For example, the part of where young people need to get appropriate information that is free from stigma is so important. And the way in which we perceive sexually active people, right? During the Generation Equality Forum in Paris, the Youth Coalition showed this video. We designed this video for the event, where a queer person was talking about how important it is to stop talking about sex from a shame perspective. And it is so important to open the spaces to talk about this in a more healthy and caring way. So thank you so much for your remarks. I think that this is really, really important. And also respecting the agency of young people, regardless of their sexual activities, is crucial for advancing bodily autonomy. Now I'm going to go with Dr. Peter Waisiwa, who is an associate professor at the Makerere University School Public Health, College of Health Sciences from Uganda. And so the question for you would be, a well-functioning, robust health system is the basis of any healthy and prosperous society, be it in low, middle, or high-income countries. The pandemic, however, has shown us that weak health systems can be severely impacted by any given public health event at any time. Given that bodily autonomy is the right to governance over our own bodies, how can we make healthy systems more fit for purpose? And by that, I mean person-centered, holistic, integrated, and at the same time, resilient health systems. So over to you.
Thank you so much. In fact, such a health system is what we all desire. Should be the ideal system to make sure that we have body autonomy, but also other services. And the WHO actually defines health systems as all organizations, people, and actions whose primary intent is to promote, restore, or maintain health. In other words, it is not just health workers, but it is all of us to promote healthcare. And the goal of the health system is to make sure that we can improve health in a way which is equitable and improves the use of services. The UN proposes that we use what we call universal health coverage, where everybody has access to healthcare, and this healthcare is of high quality and of good coverage, and it is affordable, which many people have alluded to. So in order to achieve such a system, for me, there are two major actions. One, those that are outside the health system that many panelists have alluded to. Number one, I think it is important that our health system are anchored in a system that is democratic, where there is a rule of law and also promotes good governance. Unfortunately, many countries in the world do not have democracy, and as such, many people do not have a voice, and politicians who make the decisions are not accountable. So democracy is an important contributor to make sure that body autonomy is achieved through better health systems. But also we need empowered citizens, things which are being talked through, especially empowered women, empowered girls, empowered boys, for them to have a voice in the health system, to be able to demand for healthcare, and they can be heard. But unfortunately, this is still too far. Many times communities have been left out of health system and do not necessarily have a voice. This has to change. Empowerment requires education, requires financial services, it requires reduced poverty, and also a mechanism for engagement of the health system. So actors out of the health system, there is a lot to be done. The second way to achieve this is actually through the formal health system. And WHO talks about that we have 6 building blocks. And one of the most critical blocks here is leadership and governance. I'll give you an example. For instance, if we don't have the right laws and policies, it is going to be difficult. E.g., in Uganda, for instance, we don't have a comprehensive policy to promote adolescent sexual and reproductive health. We need the right governance, the right leadership to achieve this. The second one is human resources. We need health workers that are knowledgeable, accessible, but also they put into perspective the rights of individuals in order to promote bodily autonomy. For instance, if somebody came with, has performed an abortion, the system should not discriminate against this person. They should be able to care for that person without being segregated. The need for commodities and good infrastructure. Like the previous speaker said, younger people need a system where they can easily get their care. So having like adolescent-friendly clinics becomes important. The need for good information system, data is important because data helps segregate the services utilization, either by gender, by age, or by actually levels of inequity. There we should be able to know who is empowered and who is disempowered and who is accessing services so that we can be able to intervene. But also we need the learning systems where there is research and we're able to respond to what is going on in the system. Finally, the service delivery system must be reorganized to be able to ensure that we are able to promote bodily autonomy. Services must be responsive to the needs of communities, to the needs of younger women, to the needs of also individuals, including younger boys. How are they accessing healthcare? And therefore, we need to be innovative in the way we deliver services. Unfortunately, the pandemic has made this very difficult for us, that our health system are now quite fragile and they need to be redesigned. We must finance them. We must fight corruption in the health system, and we must make the health system more accountable. We need to expand beyond health workers. We need to democratize healthcare so that everybody is able to participate in it. Innovation is like self-care, e.g. self-injection are going to be important. Thank you so much.
Thank you so much for your remarks. And I think that this is also very crucial, and linking it back to what Mavis also said before, one of the priorities of the Action Coalition on Bodily Autonomy and Sexual and Reproductive Rights and Health during the Generational Equality Forum was on comprehensive sexuality education and how to link the information that young people are receiving with the services that are available. And this also is very important for young people on how we can access services and how these services are responding to the needs of young people. We need services that are free from discrimination, free from stigma. And another important part and another important priority that young people highlighted during the Generation Equality Forum was the need of including mental health into these health systems, because mental health is also crucial for people to for bodily autonomy of young people, to address gender-based violence and to address toxic relationships. And this is something that young people also want to see. So now I'm going to move to Maria Teresa. I'm going to move to our Dr. Joya Perry, who's the founder and president of the National Bird Equity Collaborative. And I think that we're going to move on some racial justice here, which is amazing. So from your experience supporting and advocating for Black maternal health in the US, and more broadly, How can strengthening women's bodily autonomy contribute to building more equitable, inclusive, and peaceful societies? So over to you, Dr. Joya.
Thank you so much. I just want to thank you, the organizers and UNFPA, for including us in this critical conversation about personal bodily autonomy. As an OBGYN, as a Black woman whose family has been in the United States of America for at least 7 generations, it hurt my heart to see Black and brown women from Cameroon and Mexico who just last year were subjected to hysterectomies at the border of my high-income country without consent as they traveled seeking freedom through immigration. We also have found that Black birthing people in the United States, despite income or education, a Black woman who has a PhD, a master's degree, high-level education, still has more likelihood of dying in childbirth within 1 year of having a baby than a white woman who has no high school education. And yet still, despite finding that, the strategies that many governments across our nation came up with was to give Black birthing people IUDs, long-acting contraceptives, and to not actually invest in their well-being and their justice and their ability to see into the future. Bodily autonomy means that you're able to protect your body from harm. And that means that you have to ensure that people are not subjected to things like climate injustices, environmental toxins, being able to feed and grow your families as you deem appropriate. All of these are parts of a reproductive justice framework. If you are a Black person who's been in the United States of America, you recognize that having a rights framework without understanding justice can do things like say, I have the right to own, enslave, harm, sell. A right is a law that can be under a framework that is not seeing us into the future. Personal bodily autonomy is a part of reproductive justice. It says we no longer want population control. We no longer want eugenics. We no longer believe in a hierarchy of human value based upon skin color, based upon gender, based upon ethnicity, based upon religion, that all people have the ability to make decisions for their bodies around abortion, around contraception, around climate, around access to food, that there's not one part of our bodies that should be subjected to someone else's control. So it acknowledges, reproductive justice acknowledges that racism and social determinants of health are social risk factors, and that health inequities are an essential part of addressing an unfair and avoidable disparities in health outcomes. If the global community would implement a reproductive justice lens into policymaking and practice, we could work to undo the roots and the intertwining nature of all of these inequities that I've mentioned already to address health equity, so that personal bodily autonomy does not become weaponized as only a conversation about abortion and contraception, but really the belief that all people should be able to thrive, that all people deserve to be invested in, that all people should be able to have the assurances for the conditions of optimal births. So we must then be willing to address both racial and social inequities in a sustained effort. So we must promote reproductive well-being, which occurs when we have all the information and the services and support that we all need to have control over our bodies, so that we can then make decisions about our sexuality, about our reproduction throughout our entire lives. So it's not one moment in time. It's not just at the point of birth or at the point of a decision if you're going to give birth or not, or remain pregnant. And if we don't invest in the fundamental human rights for all people to have access to non-coercive health services and social supports to experience optimal health outcomes, we won't see the growth that we all deserve. So ending the Hyde Amendment and moving to a framework of respectful maternity care, ensuring that we have ending all the bans on abortion, all the things that our country has spread across the world come from this devaluation, this idea of a hierarchy of human value based upon skin color. This white supremacy culture must end and patriarchy must end so that we can have personal bodily autonomy. That's it.
Thank you so much for that, for your words. I think that this conversation is crucial, and this is a conversation that we're having at the Youth Coalition on how to advance sexual and reproductive health and rights from an anti-oppressive approach, because the concept of intersectionality is often confused with inclusion and diversity, and it's not enough to address all of these inequities. And We see this happening every single day with indigenous women with disabilities, with racialized women, with immigrant women. So this is, I love what you said about we don't want control of our reproduction, and we don't want more eugenics. So I think that this is crucial. And I really think that this is why we have to center bodily autonomy in the conversation around abortion as well, because it is our responsibility as young feminists as well to stop reproducing harmful approaches to abortion that target poor women, racialized women, as in like they are not supposed to have babies and to form families. And yeah, I would love to have this conversation for like 2 hours, because it's just very important for the Youth Coalition as well. So thank you so much for your remarks. And I'm gonna pass it over to Maria Teresa Rivera, who is a human rights defender and a women's rights activist. Maria Teresa, you are a powerful advocate for women's rights and bodily autonomy. What are some of the risks to their health and well-being if women cannot make their own decisions on their bodies and lives? So over to you, Maria Teresa. Estás en mute, podrías acá abajito en el microfonito, al lado donde está la cámara. Perfecto, ahí estás.
Hola, muchas gracias por la invitación. Gracias por darle la oportunidad a la mujer salvadoreña. En este día, pues, yo estoy muy agradecida con ustedes porque la voz de la mujer salvadoreña ha sido, no ha sido escuchada en nuestro país, lastimosamente. Seguimos siendo discriminadas, seguimos siendo no escuchadas por el Estado salvadoreño. La pregunta es bastante grande. Los riesgos son tan amplios como demoledores, ya que, como ustedes conocen, la historia de las 17 y más mujeres que hemos sido criminalizadas y condenadas por la total prohibición del aborto en El Salvador. Y no solo en El Salvador vivimos esta situación, o sea, estos riesgos de nuestra autonomía corporal, ¿verdad? Donde no podemos decidir sobre nuestro propio cuerpo. En primer lugar, la falta del acceso a la salud no nos permite tener conocimiento real de nuestra propia salud y cómo están nuestros propios cuerpos, de cómo podemos prevenir ciertas enfermedades, y esto nos lleva a finales tan dramáticos como emergencias obstétricas, como la que yo sufrí, como fui condenada a 40 años de prisión, ¿verdad? En El Salvador, las mujeres, especialmente las mujeres pobres, somos invisibles para el sistema sanitario, judicial, y eso nos implica la nula capacidad de decidir sobre nuestros propios cuerpos. Sabemos que hay tanta desigualdad, ¿verdad? Hablan de igualdad, pero en mi país hay tanta desigualdad como en muchos otros países, donde las mujeres pobres seguimos siendo criminalizadas y condenadas, pero las mujeres ricas pueden decidir, ¿verdad? Y los derechos reproductivos, sexuales y reproductivos son para todos, ¿verdad? Pero en mi país esto es lo que está pasando, ¿verdad? Como en otros, como en Haití, como en toda Latinoamérica, ¿verdad? Esto hace que ni siquiera seamos capaces de, cuando no nos dan el derecho a la salud, no seamos capaces de saber si estamos enfermas o estamos sanas, ¿verdad? En mi caso, como el caso de las 17, porque hoy no hablo por mí, y siempre he dicho, tengo la oportunidad de hablar por las que ya no están, ¿verdad? Todos los riesgos, como por ejemplo la muerte de Manuela, la muerte de Beatriz, que fueron producto de esta discriminación hacia nosotros las mujeres en El Salvador, ¿verdad? por ellas, por las niñas que están siendo violadas y criminalizadas. Debemos seguir trabajando para que las leyes cambien, ¿verdad? Así que muchas gracias por esta oportunidad y debemos seguir luchando para que todo cambie, y no solo en Latinoamérica, sino que en muchas partes del mundo donde las mujeres y nuestra autonomía corporal no está siendo respetada, ¿verdad? Muchas gracias.
Thank you so much. Mucho fuego, compañera, mucho fuego. And thank you so much for those remarks. I think that, well, a little bit of my background when I was still living in Mexico as a human rights lawyer was to also work on the access to justice and the criminal justice system. And I'm going to go a little bit radical here, but I still don't understand why we are using the criminal justice system that we know that is racist, that is classist, that is perpetuating all the inequalities that exist in our countries to address something that is around bodily autonomy and that is a matter of health and not a matter of criminalization. Well, it shouldn't be a matter of criminalization. So thank you so much for those remarks. And now I am going to move forward to the second part of this panel. And this second segment is going to focus on the actions that we must take and the actions that have to be taken. And we are going to go to, well, I'm going to ask a question for all of you, and I'm going to ask you to respond in 2 minutes to have a more fluent conversation about this. So, where do you feel that the global community needs to focus its attention to protect and promote women and girls' bodily autonomy as part of efforts to achieve health and well-being for all? What lessons have you learned from your experiences that could be instructive for others? So I'm gonna pass the mic to Maria Teresa. Would you like to start by telling us what are the actions that should be taken to advance and promote and respect the bodily autonomy of women and girls? Over to you.
Hola. Creo que como sociedad somos un motor importante. ¿Aló?
Te escuchamos perfecto.
Okay. Creo que como sociedad somos un motor importante para exigir a los gobiernos que no se cometan barbaridades judiciales y sociales como está ocurriendo en El Salvador con las 17 y más. Ya que, por ejemplo, ustedes saben, ustedes han leído mi caso, ¿verdad? Por la persecución judicial, yo tuve que salir de mi país por alzar la voz por otras mujeres y que no me arrepiento y lo voy a seguir haciendo, ¿verdad? Hay que sumarse a las campañas a favor de la despenalización del aborto, ¿verdad? Replicar denuncias y presionar a los gobiernos, que es lo que necesitamos, ¿verdad? Ahorita es presionar a los gobiernos y especialmente ahorita lo que está pasando en mi país, donde ahorita se presentó una propuesta de ley para la interrupción por 4 causales y ahorita solo está estancado, ¿verdad? Muchas gracias.
Thank you so much, Maria Teresa. I think that, yes, it is so important that we support feminist collectives who are pushing for legal abortion and that we replicate and share information about the situation of women who are defending the rights of other women to choose over their own bodies. I think that the example of Latin America is crucial, how Latin America and the women and the feminist movement in Latin America has a lot of power because of its collectiveness, because of its collective nature. So yeah, I totally agree with you. I think that women's voices have so much power when they are together. And thank you so much for that reflection. And now I'm going to pass the mic to Dr. Yoya Perry. Please come on in. What are your reflections on what needs to be done?
Thank you so much. You know, what we've learned over the years at the National Birth Equity Collaborative, especially in our global work, is that you must listen to women. Really, we have the answer. They have the answers on the ground. Women around the globe already know what's needed in their communities, but often the global and international development sectors ignore those needs and act based upon their own priorities. Women in some circumstances are asking for food to feed their families or help with fighting against and pushing back against toxins in their waters. But we show up and ignore those asks and go straight to what we think our agenda should be. It doesn't make sense. It's still paternalistic and it's still a colonized behavior. So it's critical that the global community take on this reproductive justice approach to ensure that all the pillars that are necessary for bodily autonomy can be achieved. This includes prevention of patriarchal violence, addressing climate. As we know, women will suffer most at the hands of environmental disasters, allowing women to get a living wage so they can support their families and themselves. There is so much more than just family planning. We have to move beyond only talking about abortion and maternal health. If we want to truly have bodily autonomy, women must be autonomous in all aspects of their lives. So it's important to envision a world wherein every human being has the freedom to experience full spectrum sexual and reproductive well-being, not solely focused on reproduction. It's then crucial that we have reproductive and sexual fulfillment, pleasure, healing, and joy when we have this discussion about well-being and personal bodily autonomy, instead of focusing on the absence of disease and distress. That is it.
Thank you so much, Dr. Yoya. I think that what you said is crucial, and it's also very important for young people's agenda. During the Paris Forum, we also committed as Youth Coalition to advance comprehensive sexual education from a pleasure perspective, from a holistic perspective, and from a perspective that centers the identity of people, and not only like the reproduction and their biological status, or like their biological processes. And that is crucial for young people, because young people want to enjoy their lives, right? They're not thinking about like reproduction, they are thinking about enjoying themselves.
Pleasure is good, yes.
Yeah, that is crucial for the youth agenda. So thank you so much for raising that. And I'm gonna go with Dr. Peter Weisbach. Please come on in.
Yeah, I think one of the key lessons is that strong health systems that are resilient must be country-led. Also, we need to finance country systems, and we need to build local capacity. The pandemic has taught us that we cannot fly in solutions. The solutions have to be homegrown. So I think that's important, the importance of local health systems that are strong. A second one is that solutions need to be co-created with the local communities. And that includes like younger people, and also girls and women and all vulnerable people. But also actions outside the health sector are quite important. The role of CSOs and NGOs are important in order to exert pressure and accountability on the system to be able to respond. Yeah, I think for me, those are the major things. And of course, I'm coming from academia, and the importance of academia to document, to create solutions, innovations is going to be important. And most of those have to be local, just like they're happening right now during the pandemic, when people from the West cannot necessarily travel to, let's say, Africa or Asia or South America, although we can collaborate. Thank you.
Thank you so much. And I want to touch upon something that you just said that is crucial as well for the youth agenda, which is the co-creation of public policy. And this is something that we have highlighted as youth leaders during the Generation Equality Forum with the design of the Young Feminist Manifesto, where we highlight the principles that must be observed for meaningful youth engagement, which are co-creation, co-design, and co-leadership of these policies, so that young people can actually be engaged, be involved, and be listened to what they want and what they need. And I think that this is also something very interesting that also touches upon something that Dr. Joya Perry just said about decolonizing the health system and acknowledging that women also hold a lot of power. And we see this with some conversations that we've had with indigenous leaders and the need of the respect of the traditional medicine and the ancestral knowledge of indigenous communities. And also, I think that this is the self-managed abortion is also an excellent example of how we can start decolonizing the health systems. Well, I'm gonna go over now to Mavis. Mavis, do you wanna come in and share with us what is needed to advance bodily autonomy?
Okay, and so I'm talking about advancing bodily autonomy. I think that from the experiences that I earlier shared, there's the need to focus on building the capacities of young people in terms of their finances, especially with young people out of school, because they really fall prey to a lot of people, a lot of men, because they'll have to involve in transactional sex before they are able to cater for themselves. And so there's the need to empower them financially so that they can cater for themselves and not rely solely on a man to make them survive. And then also there's the need to start the education of sexual and reproductive health at an early stage, so that by the time adolescents grow up, they would have learned a lot and they would have built their confidence and been assertive so that they can use the information that they have in their lives and to also make the right decisions. And also there's the need to strengthen the systems, because we have a lot of policies that are protecting the rights of women and girls. But when it comes to implementation, we have a lot of challenges that we encounter. So I think that the focus also must be on implementing some of these policies that we already have, and also to support certain countries which may be lacking behind. And so there's the need to also focus on that. And so making the right choices at an early stage and also reducing the rates at which we record sexual and gender-based violence also becomes critical. And also to encourage the adolescents to know their rights, because the moment they know their rights, they demand them. But if they don't know the rights, there's no need or there's no opportunity for them to even demand for the right that is deemed them. Thank you very much.
Thank you so much for those remarks. And I think that it's also crucial to, on what you just said about how it's important that adolescents and young people know their rights. It is also important to make accessible information for them. And I think that the work of the youth-led organizations is crucial on developing accessible and appropriate information for young people, and developing accountability mechanisms to hold governments accountable for youth rights. And that is something that is crucial, and that is something that hasn't had enough funding. And it is so important and crucial to fund youth-led initiatives because of this reality that Mavis just highlighted. So I'm gonna go with Emma. Emma, over to you.
Thank you very much, Eunice. I think last week the world engaged with groundbreaking Generation Equality Forum, where countries committed to significant investments to advance gender equality. And I think it's imperative that the global community understands that gender equality is not possible as long as women do not have control over their own bodies and decision making. Efforts to advance gender equality must go hand in hand with efforts to uphold sexual reproductive health and rights. And this has clearly emerged from both the Nairobi Summit in 2019, which I was fortunate to attend and witness, and the just ended Generation Equality Forum in 2021. I would also like to say that as a country, Namibia, for example, we have taken decisive action to improve health and the protection of systems to uphold and protect sexual reproductive health rights. But there's still issues. HIV and AIDS still continues to be a burden, with an adult prevalence of 11.7%, where women or females are more prevalent to the virus than their male counterparts. But there's a good side. Namibia has exceeded the 90-90-90 targets of treatment, care, and support of the viral load, and it is progressing in the fight against HIV and AIDS. When it comes to reproductive health, I've said earlier, we have managed to remove the tax on all menstrual health products, and we have embraced the utilization of modern family planning methods. We've also introduced long-acting reversible contraceptive methods, such as implants and patches. Finally, I think the global community needs to avail funding for universal health coverage, funding for sexual reproductive health rights, and comprehensive sexuality education, and allow young people of childbearing age to decide and design and lead these interventions. And I also hope to see a future by Vision 2030, whereby adolescent girls and young women in Namibia, Africa, and the world are free from sexual and gender-based violence, are free from discrimination when they make decisions, pertaining to their own bodies, and that they can protect their bodies from harm, both from online harm and offline harm in digital spaces. Thank you.
Thank you so much, Emma. And I will add to your reflection something that you mentioned at the beginning, which is removing the stigma of young women who get pregnant so that they are able to go back to school, because this is still a reality in many of our countries, at least in Latin America. This is such a reality that young women who are giving birth, who are becoming young moms, are not being respected as holders of rights, and this is bad, and this is preventing them from accessing different opportunities, and this is holding them back just because of the stigma and discrimination. So thank you so much for your remarks. This has been a very amazing conversation, and I am very honored of having shared this space with you and of being your moderator today. And now thank you so much for these critical reflections. And now I'm going to I would like to hand the floor back to UNFPA for some closing remarks. So please, now we will hear from Mr. Peterson, who's the Deputy Executive Director of Management of UNFPA, for the closing remarks. So over to you.
Thank you, Eunice, and good morning, good afternoon to everybody. Thank you so much to all our panelists here. I always feel a bit humble when I have to, do the final remarks after such a rich conversation, after such really strong interventions and points made today. So thank you to all of our panelists here. Thank you also to you, Eunice, for excellent moderation. It's been a pleasure. We've had the privilege of hearing from a number of different angles, countries, points in life, generations in this panel debate. Thank you for sharing your experiences, thoughts, and ideas. I think we learned a lot about what is actually, we first of all learned a lot about women's bodies and choices. They continue to be controlled by others. This is a major hindrance for achieving the SDG3. We also heard what it actually means in terms of the daily life of millions of women and girls. I cannot overstate how impressed and how much I respect what you're telling us here, Maria Teresa, Joya, our young people, Mavis, and so on. This is so important, pointing to what does it actually mean to empower women, adolescent girls. It means that they need to know about their rights, also about how their bodily functions are, what kind of health choices they should have, that they have access to that, to also to economic empowerment, as Mavis also pointed to here. So lots of very good concrete points to what does it take if we want truly to achieve the SDG3 for every woman and every girl, total inclusivity, total equality. That you have pointed to what is needed, and let me just underline that UNFPA is committed to this mission, and we think it's central to that all that we're doing. We know also that the COVID pandemic actually had a major impact on this, on the rights that we hold so dear, and also the risk of negation, violation, and dismantling. Peter also mentioned that sexual and reproductive health services that countries have put in place have been dismantled. Workforce transitioned to the immediate pandemic-related services and care. Increases in gender-based violence and harmful practices, alongside very, very worrying reductions in access to healthcare, employment, and education. So we cannot wait. I mean, this is really a strong call to action from our panelists here, and we need to begin build back more resilience systems and structures, ensure in reality the sexual and reproductive health and rights for all, and really remove barriers to accessing quality care, and also barriers to the right to make choices about one's body. That's really the agenda. So thank you again. Let me just round off by quoting our executive director, Dr. Natalia Cannon, from her statement at the Generation Equality Forum last week. Quote, "We must deliver on our shared vision of a gender-equal world where every woman and girl can confidently proclaim, 'My body is my own.'" So let me thank you once again all for your engagement, commitment to this critical dialogue. Again, from UNFPA side, we are ready to partner and follow up. You set the direction. We are ready to partner, and thank you all. Also all those who joined us this conversation on YouTube. We have less than a decade to materialize our SDG commitments and our commitments from the Nairobi summit and from last week. SDG3 is central, so central to all other SDGs. And to make it happen, we will depend on strong, inclusive, multi-stakeholder partnerships where every voice and every action counts. We have heard a lot of good examples on these, what should be good actions. We've heard from Emma how you actually use the political parliamentary platforms to create concrete actions in terms of this. This was really also fantastic. So let's get started. Let's continue. Let's strengthen our efforts. Thank you again, everybody. We need to ensure no one is to be left behind. Thank you very much.
Thank you so much, Mr. Peterson, and it is a pleasure as the representative of the Youth Coalition to be in this event. We know how flexible and youth-friendly UNFPA is, and we really appreciate that you are always inviting young people to these events. And we also appreciate a lot the willingness to partner with young people. We are witnesses of how important and how nice it is to partner with UNFPA. So thank you so much for that on behalf of the Youth Coalition. And just to finalize this amazing panel, I just want to share a little bit about some reflections that we had from both the Generation Equality Forum and the conversations that we've been having as youth leaders on bodily autonomy. And we just want to share that it is important for young people to have a seat on the table, to co-lead and to co-design strategies addressing bodily autonomy and sexual and reproductive health and rights. Often, many initiatives that are targeting young people, but very few of them are actually engaging young people in the conversation to be leaders and to design and to own the spaces. And I think that the role of young people during this last year in the global sphere on sexual and reproductive health and rights has been very important, because we are here to disrupt the current structures, to question who has a seat on the table, and to question why are we doing this in the same way that we have been doing this for the last 25 years. We want to see systemic change, and we want to see transformation. And we really think that a world where young people lead the conversation is possible. And as a Youth Coalition, we are committed to work for the next 5 years to advance comprehensive sexuality education and bodily autonomy from a holistic approach that centers the voices of young people, regardless of their background and regardless of their expertise in decision-making spaces, so that we can really develop advocacy strategies that center the voices and the needs of young people, that centers their identities and their needs and their wishes, instead of only targeting, as Dr. Joye said, the reproductive part of it. So thank you so much for being here with us. On behalf of the host UNFPA in Argentina, I would like to thank all of the panelists again and the audience for tuning in. We wish you a great continuation of the high-level political forum. Have a wonderful day or evening, wherever you are. Thank you so much for everything, and goodbye.
Goodbye.
Bye-bye.